Hello, 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 everyone. This is Irene with SaugaTalks here, and my co-host Brian Thomas. Brian, how are you?
I'm doing fabulous. It's Friday, but we're one day closer to my favorite day, which is Monday. But what's really cool about this, again, I jump out of bed on Fridays because we have these live talks, but a great friend and colleague of mine has to join us today. So I'm so fired up about this. So thank you, Irene.
Loving it, loving it. So just before we get going, please follow SaugaTalks on LinkedIn and YouTube and Facebook. Same with Coruzant Technologies because Brian's leading fantastic publication and there is wealth of knowledge and information there on portals, on YouTube, on podcasts. So absolutely. So today we're extremely privileged. With us here today, Sarah Richardson. Sarah, how are you?
I am well, and I agree. Happy Friday. It is actually my favorite day of the week is Saturday, Brian. So I'd love to hear more about your Monday perspectives. But yes, Friday is always the best day to do any kind of event because you're there, like you're ready for the weekend, and yet think of all the knowledge you packed in just the last 5 days. So I always love Friday conversations. I feel like you already know what happened, so it's great to discuss what you learned.
That's why we here, Sarah, absolutely. I recently ran Twitter poll on when people prefer to listen to technology talks. What time of the day, what time of the week, Thursday evening, Wednesday evening, Friday afternoon. Guess what? This 1 p.m. Eastern spot won everything because people, like you said, right, people ready to unwind from the week a little bit and give it a thought, give it a thought. So, Sarah, thank you so much for being here. We do want to talk about healthcare technology with you for a number of reasons, and mostly because you're a leader, you're a practitioner, you're an influencer out there in healthcare space. So we'd like to hear, where do you see we going? Because in 2020 we experienced quite a turmoil in terms of services, in terms of technology, in terms of digital transformation in healthcare. Could you please describe where do you think we are? State of healthcare tech for now?
Sure, absolutely. And remember, this is like my perspective of the world. So I would say, like, in my humble opinion moment, here's what I love about where we are right now is that when you're a technologist and in the industry, healthcare happens to be one that is like people talk about the resiliency of healthcare, is that we are embedded everywhere in every organization. And it's not about being the most important department in a company. It's about the sense that tell me a place in an organization today where in healthcare or any industry where IT is not part of the equation. It doesn't exist. And every once in a while, I teach CIO boot camp for Chime, and they'll say, oh, well, such and such is still on paper. Not like the EMR, but maybe like the environmental services department or different areas are still on paper. I'm like, but you won't be someday. And regardless, the technology already exists that you could modernize that if you chose to do so. And so here's the thing. We are always prepared for what's going to happen. And it was terrible that a pandemic had to be a catalyst for so many of the things that we already had teed up in our queue or were doing in pockets. And some organizations were more advanced, whether that was the working from home capability in whatever environment you chose to do that, whether that was telemedicine being provided to patients, whether that was even in the security sense, like multi-factor authentication, like you had all these things already ready to go, or you had the technology right at your fingertips. But it tended to be governance or cost or bureaucracy or whatever reason didn't allow you to necessarily roll those things out in the manners that could be most effective for an organization. And that's what you saw a pandemic do for people. Like, hey, guess what? Telemedicine's been around for 20 years or more. And yet it became the primary way in which many organizations were able to deliver care to their patients in a multi-specialty environment. So you may have a patient, 62 years old, let's take this person, who now is able to get their labs drawn and from one lab draw have multiple follow-up appointments with specialists through telemedicine that perhaps even before the pandemic would have been difficult because of access to care from where this person lived or the ability to get to care. And now all of a sudden, it took some time teaching them the technology. And now they have this at their fingertips in their wellness plan all of the time. So the pandemic was a catalyst for us. We have to make sure, Irene and Brian, that we're always looking for what's the next catalyst that drives the ability for us to catapult some of our technologies into the mainstream.
You're absolutely right, Sarah. And this was a major catalyst. And I hope that what we've learned from it is that, it's one of those things like history. We don't learn. I forget the saying now. We learn what I forget what that is. I'm sorry. I usually spin that one around.
If we don't remember it, we're doomed to repeat it.
Exactly. Yeah. But let's hope, in a year, 2 or 3, we don't forget that, gosh, we got here because of this. Again, the silver lining was this catalyst or this pandemic, which is sad, but the silver lining is we did really move the needle this time. And I know digital transformation has been, that word's been worn out. I get it, but we have transformed because of that innovation. And so I think that's a great start to this conversation today. But Sarah, just a small, tiny question here is, so out of this, and you and I have both been in healthcare a long time. Like I said, we're colleagues, friends. But what do you think is most promising in the healthcare space, at least? We ask this question all the time, but in the healthcare space, what's the most promising now that we're moving out of this pandemic, hopefully? Is it something that you see in machine learning or blockchain or anything like that you might want to share with us?
Sure. I'll talk about a couple trends that I believe are important, that have been out there for a while. And I look at my notes just because that's kind of my whole space. There's a few things that are really important. We have always talked about the consumerization of the patient being at the center of their care. And yet, when's the last time you were able to get your records from multiple locations easily? And guess what? It still doesn't exist. Regardless of interoperability, regardless of 21st Century Cures Act, regardless of all of the activity that's out there mandating that there's no data blockage, et cetera, you as a patient, if you have multiple physicians in different healthcare systems, or you've moved a couple of times, or you're a snowbird, you name the scenario. If you are not geographically centric to your care provider within the same healthcare system, it is still monumentally difficult to keep all of your health records where? Here, on your phone, as you should. So I'm still a big fan of the National Patient Identifier and working with different PACs and different groups to say, why not an NPI? And the number one reason's always been, oh, well, it's too much of a risk for privacy. And that's not an answer to me anymore. Like, are you kidding me? If you have any form of social media or free email or anything else about you out there, you're already giving all of your information away. And I get that there is a limit to the space that says, but that's not my personal healthcare information. I don't really care if you have my personal healthcare information, if it means I could get all of my data in one place so that I could carry it around as an avatar on my phone. But here's the real answer. If we follow all of our own security and cyber best practices and put our data in with a vendor, and I'll leave, I'll leave Google, Amazon, and Microsoft out of the equation, but pick one of them. What's the likelihood that they're going to actually get a breach that's going to steal your patient information? That would likely be like a national attack on us, which would have far deeper implications than whether or not you have a condition that you don't want people to know about. And so I'm a huge fan of saying, if we can keep that information safe, I'm even so far as like, use my social security number. That's what I have all of these different privacy groups monitoring for me anyway. Like, we pay to have that monitored. I'm not going to say this, publish my social security number, but you get to the intent of like, we use our social security number for major forms of payment and support of our nation. How could we not, or how would we not know how to keep an NPI safe as well? And when you get to a place where you really can have all of your information available to you so you can share that with your providers on demand, it makes your own care easier. Anyone who's ever had to have elder care and be taking care of other people and their families, if you're a parent, like, what an NPI would do for us as a country would be huge in terms of this interoperability, that sharing, the ability to have care anywhere. So patient consumerization, put the data in the hands of the patient because it's their information anyway.
Absolutely, and this goes, along with the trend I'm reading a lot about, how patients increasingly drive healthcare experiences and expectations, and frankly, doctors, providers, vendors, healthcare companies have to now adjust. So where do you see we're going? Because we already got so much, in control. I mean, we can use telehealth, right? We have our phones right here, right? We are now more freely speaking with our doctors in those visits, right? Instead of really, right, going into doctor office. So where do you see it's going? I mean, are we really equipped well with technology as patients now?
Yeah, there's a couple trends that I see, Irene, that I really like. Couple of things are like, hospitals used to compete against each other for business, and they're still going to do that. Medicare is going to compete for patient lives during annual enrollment, and hospitals are going to compete for patients, for primary care, for surgeries, for all those things. There's also a sense, especially from another driver from the pandemic, that we've heard the term before, co-opetition. Great. But systems are working together more than ever to say, am I the best place for you to get this care? Because the patient wants best quality outcomes, best price, best continuity of care long-term, best opportunity to not have a readmission or to be admitted in the first place, et cetera. Where is the best place to receive that care? And you see healthcare systems now working together to not always have competing services. If you're going to saturate a community with being truly the best at certain things, you don't want to have 3 of the same program in an area where another one that is needed doesn't exist. And so there's actually conversations that happen between healthcare systems now to say, where's the best place for these certain things to occur? There's a big piece of that personalization of care. And so you may go to the best people even in the country to solve certain problems. Like often it's cancer that is the driver to go to an MD Anderson or Cancer Treatment Centers of America. And so why don't we start to specialize in certain areas across the board for all those things? If you have this condition, this is the absolute best place where you can go get care, and your insurance allows you to do that. Another piece of all of that is that we are very much in a gig economy. So if you are a hybrid work environment and you can work from anywhere, and there's all kinds of conversations going on about who should go into the office, when should they go into the office, what makes sense, etc. Let's assume you have the opportunity to quote unquote live anywhere. And I work for an organization, I'm very fortunate, Tivity. We have 2 primary offices. We also have about a third of our team that is all over the country. I'm in Los Angeles. I'm the only person, actually there's a couple more colleagues, but for the most part, I'm the only person in Los Angeles in my company. So I don't have an office to go into. So I do use telehealth, and I do have a hybrid environment. I can fly to an office to go in for the day, etc. When you start to think about the fact that maybe we have contractors from all over the country, or we have team members who live somewhere else, for the ability for those people to not have to sign up for new benefits every time they go to work for an organization, how do you create healthcare plans that allow people to be in control of their own healthcare insurance? Because let's just say that you go to a new company every year because you are a contractor, you're on some kind of a gig economy, then that means that every time you have to re-meet your deductibles, every time you have to re-meet all of your different plan requirements. If you had a plan that followed you, just like your information followed you, you have so much more freedom in what that means to own the personalization of your own care. Those are a couple of the trends where the technology is already there, which I love, is putting the consumer not only at the center, but creating the knowledge and awareness of what that means for the consumer. We're as responsible for talking about the benefits that are part of your plan as much as we are about how to utilize it in the most efficient manner so you can stay healthier, longer, and live the life that you want to live.
That's a great point, Sarah. And you know, we talk about this every week. We talk about the technologies that are converging and they're actually supporting one another. It's kind of sounds weird the way that came out, but at the end of the day, you know, the consumer is the one driving this, and we've got to get more groups. And like yourself, Sarah, you're an influencer. I know many influencers in the healthcare community, and we've got to get more active and more vocal. So I know you're part of HIMSS, you're part of Chime. And again, for the folks that are listening in right now, these are healthcare organizations that are centered around healthcare leadership, technology, et cetera. But how do we get more vocal in that, Sarah? I just wanted to ask your opinion. You know, I think those are our platforms to get up there and speak and say, gosh, we got to move the needle. And Sarah, I've been in healthcare 20 years, like you, a long time. Healthcare is always slow to adopt. What's your thoughts on that? How do we get this? How do we move the needle?
So the first piece is, what needle do you want to move? Every organization has their big rocks. Those are the terms I use. My staff's like, where'd you ever pick that up? I'm like, a couple bosses ago. I like the term. I use it. What makes your organization successful in its niche, in its place that it is. And this means like you could be a healthcare wellness company all the way up to a massive healthcare system. But there's a part of it that you are tied to, and you understand like this is where the most delivery and value from our organization comes from. I hope it's tied to your mission, vision, values, and strategy. Please let that be a true statement. We teach that in boot camp. We teach it all the time. Please let that be true. And in whatever flavor of that truism is, where is the greatest benefit to what you're delivering? So here's a perfect example. We are all about understanding who our members are. That personalization, back to knowing that all the data that we have about you from the health plans, putting that into true omni-channel marketing as an example, not so that we bombard you with information, so that we absolutely know that Irene likes to go to the gym 3 days a week. She likes to go at 10 a.m. She likes to take weightlifting class or strength training class along with yoga. And she spends about 3 hours there because that's her social time too. So now if I'm going to include mental enrichment and social engagement in the products that I'm going to offer you from my organization, then I already know that those are areas where she has an interest. So when she logs into her portal that we provide, there's a personalization effect that's not creepy. These are things we know about her. We know to offer her classes about yoga and wellness. We know to offer her different meetup groups that are within her own areas of interest. We know that the determinants for her are maybe access to healthy food, or she likes to be able to go to the farmer's market and go home and try new recipes. Those are the things we learn about her because she uses our services and we share that with her and she consumes it. And therefore, there's this complete wellness plan around Irene's habits that we provide to her, but we provide to 17 million people. But every time she's a part of us, she feels like it's only about her. That's huge. Those are the needles you start to move. Because of course she wants to do business with us because, oh my gosh, why wouldn't she pick a Medicare plan that has Silver Sneakers? Because Silver Sneakers has all these amazing attributes and aspects that are customized to her. That's huge. And then we know already, maybe she did get hospitalized. Maybe she did get discharged with a hip replacement. Well, guess what? Balance is going to be a big level of importance. Her mobility, the things that she needs to be well and to heal correctly and to not get readmitted or not have another mishap or something occur in her life. Those are the things we need to pay attention to. Those are the type of needles you move by understanding how each person is affected in your system. But guess what? You better have super clean data. You better scrub it as it comes in, know where it's being mapped, have lineage, have it in the right containers. No, I mean, data management to me is the single most important intake factor in your organization. But then when you layer on the technologies, like how modern is your infrastructure to support that? Because if you have like huge data centers and all these different computing capabilities, is that the right place to have your spend based on how your organization uses information? Okay, and then you throw things like cybersecurity on top of that. How secure is your organization based on the type of information that you ingest? And there's all different case studies around that. I mean, there's talk that in 3 years you can't even get insurance for ransomware. And if that's true, what does that mean? It means you better have a really awesome high availability disaster recovery plan that's been tested in place. Make sure you know how to do it. Make sure your organization knows how to do it. Make sure your board's aware of it. Make sure you're actually doing it. And what's the risk and likelihood of it occurring, as an example. And then on top of that, and I think about our own organization, your product development. What type of environment are your teams developing? Are they developing things on-prem and then they load it to the cloud? Are they doing things in low code? Are they sourcing, maintaining? Do you build? Do you buy? And what does all that look like from a governance perspective? And so all the things we've done for 20 years are still there, but now it's like really know how each needle gets moved and what all those interdependencies are, because doing that sweeping change is terrifying for most people. And the rate at which you can change it is the rate at which people feel comfortable and aware and capable of doing it. And that's where I see the biggest impact in healthcare today, is that it all exists. Which pieces of it exist in a way that is most accretive to your organizational goals, and make sure you are constantly prioritizing and making people aware of that. Otherwise, you'll get off track very quickly. And all those decisions get super expensive if nobody's paying attention to how it's being spent.
Sarah, I loved how you put personalization in such a simple terms, in a way that services are invited
Yeah.
We're not hiding from that because we know it's not creepy. It's really the information, like in my example, that I shared freely. I do want health organization know, right, about my habits. I don't want them to, to find out on their own. That's where it becomes creepy. But information that I'm readily shared, and please use it for insights. I invite new services, right? I want my life better. Absolutely. So this is an excellent point. So where do you see AI and automation helping organizations now? Because there is this blurred line between what personal interest and yet what AI able to find pattern, right, in our behavior.
It again goes back to like, how do you use some of the information that your organization is bringing in? So if you can use AI to create scenarios that have a likelihood or probability of a patient or a member utilizing that service or being curious about that. So you think of AI and diagnosis, like, oh my gosh, you load all of this information in there, and then especially in like radiology and imaging, it's not about replacing the physician. It's about giving the physician a tool or deeper insight into something that they wouldn't have been able to get on their own because of the aggregation of all of that information. The doctor, I think about AI as a bit of some of the art behind it. The physician still is the science behind it, understanding what that means for that individual based on so many factors that a machine can't tell you. And so there's that space of still using the physician as the individual who has to deliver the information as well, no matter how smart our systems become at uncovering patterns, diagnoses, likelihood, desire, intent. To this day, the most effective form of communication is human to human. I don't believe that will ever change. And besides, it's humans teaching computers what they need to know. So you always will need a physician. You will always need a care coordinator. You will always need a practitioner to be the one to guide you on any journey you're on, whether that's a wellness journey or whether that's a sickness journey. And sometimes we are on sickness journeys. I mean, there are myriad different conditions that don't allow us to ever be truly well again. How well can we be? I joke that there better be a robot in 40 years when I'm ready for full-time care because I don't have kids. So there's the assumption that whoever said your kids were going to take care of you anyway, that creates a whole new dynamic that no computer can solve, by the way. So those are those pieces of like, if you put all of the right tools at the right time into the hands of humans, they still have the biggest impact on one another. And that's where those thoughtful decisions about what we use and how we use it, including the logic about how did the computer know to make these decisions? And so when you throw new solutions out there, I work really hard with our business partners and our product owners to say, we can automate anything you want in theory. We can put technology around anything you want. What is the desired intent based on the processes and workflows that you have today? Can we also make those better as part of the partnership? Or can we enhance things that you've already done incredibly well? Because you'll never eliminate the human factor. And that's what I always believe is important for people to understand, is that automation just allows you to go practice at a higher licensure. And I use that terminology even in IT, because we say that about our physicians. Like, if we do this, this means you get to do these other types of activities that you want to do more of. Same thing in IT. There is no cosmic joy in handling tier 1 service desk tickets. There's no cosmic joy in monitoring half of your systems in your NOC. You want everything to be exception-based wherever possible, but you have to know what's creating those exceptions in the first place.
Absolutely, Sarah. That's some great points. And, you know, I do agree with you that the humans will always be involved. We've interviewed a lot of people. I've interviewed probably 350 guests, many of them out of Silicon Valley, some unicorn tech companies. And quantum and AI is going to be a game changer. And quantum, they say, is about 6 years away from being mainstream. China is by far has invested the most in quantum. The United States is lagging behind, but there's a lot of promise to that. And so I'm hopeful that while we still need that human interaction, I think it's going to be a transition. Of course, everybody's going to have to get on board, but I think, Sarah, I hate to say it, but in 20 years, I think you may have a robot doctor, because some of the things that I've seen today that's coming out just blows my mind. And I'm like you, I'm old school. I like to have that, COVID killed me emotionally and mentally. I wanted to be in the office and see people because I'm a people person. But I think it's going to change, and people are going to fight it, of course, to the very end. But I think it's going to be sooner than what I think it is anyway. But that's fine, and I'll leave it at that. So, Irene.
Yes, to pick up on that. Yes. So let's look into future a little bit, this shiny, interesting upcoming future, augmented reality, virtual reality, plus wearables. Okay, pretty soon we can model every condition and really train doctors, train nurses, train patients, right, to live with certain conditions, right? So where do you see that? Yeah, that future lies.
So I love all of it. I am the most this connects to all my devices, all my everything. I saw a study, it came out, I think, like 2 days ago, about how 10,000 steps was never like a real thing. It was just some arbitrary number thought up once upon a time. It may actually be harmful to some people based on some conditions. Think about this, though. Here's why I like wearables. Keep it simple. If your wearable is dialed into your conditions, it's going to tell you when there's something that's abnormal, as much as it is a gamification of telling you when things are right. So if I know I'm supposed to have X amount of calories burned per day, or steps, or stand up, or do whatever I'm supposed to do, when it gets more and more personalized, then I'm like, all right, it's incentive. Like, I literally last night was 10 calories away from hitting my calorie goal for the day because I'm an Apple fanatic, and my July challenge is to hit my exercise goal or my calorie goal 22 times this month. I'm like, done. So there I was running up and down the stairs last night just to meet that. Now that accretively goes into so many other different aspects of my wellness. But you talk about the whole like quantum AI space. So the ability to know things in some cases before we know them. You think about spatial web 3.0. I love this because you'll see the pictures of like when you get on your Peloton or you get on your treadmill or whatever you're using at the time, they get to a point where it's actually real-time data that's just in front of you that's going to give you all of the different inputs you need. Imagine waking up and you get scanned from head to toe, telling you where your hot spots are. You could detect something before it's even, in some cases, detectable today because all of a sudden this body scan sees something that's irregular. It alerts your physician or whomever needs to know, who then calls you and says, this actually isn't a big deal. Let's just pay attention to it every day. Or, you know what? I need you to go ahead and come in. You're already scheduled. You're already made aware. It goes to your different devices. Like, you think of the proximity of if you're a diabetic and your blood sugar is low and you need to eat, and it tells you you're near a tender greens. And so if you go and order the salmon and salad, it's exactly what you need to be okay. And so you say, yes, order it for me. You go pick it up. Like, those levels of wellness are incredibly important. But here's the thing about human behavior that we don't change much, regardless of the amount of information. For any human to want to change behavior, the need to change has to be greater than the benefit. Because if I tell you you should eat 50% of your meals as vegetables, do you do it?
I love vegetables, but I see your point. Yeah, I see your
I tell you to walk 5 miles a day. Are you going to do it?
I'm bad at following directions there. Yeah. I hate instructions. I hate instructions. So I do on my own pace. So yeah.
People will only do what they like to do. If it's painful or they don't, and I don't mean like physically painful, but if it's painful or it's hard, most people don't want to do it. I work out every single day and it's a job. It is a job.
You're very disciplined. Yes, exactly. Yeah.
And 66% of Americans are obese. Like, that means that their BMI is higher than what is considered healthy. And the number one contributor to COVID was what? Obesity. That's not what we talked about in the news. We didn't talk about the fact that if you are obese by your BMI metric, which isn't the perfect metric, but it's pretty darn close, it's good enough, height and weight, then you are at greater risk of getting COVID or several different diseases based on how much you weigh. Would that not be a reason to eat more vegetables and go for a walk? Guess what? It's not.
It's not. It's not.
But we didn't hear that through COVID. The media wanted to play its own story, and I wish, Sarah, I wish they would say more of that. That way people would wake up and go, you know what, they're right, versus, the fear and got to do this and you got to get a vaccine and all that stuff, which, we need to get. But
Yeah,
the media played this whole thing. I'll go off.
get a vaccine and eat your vegetables.
Yes, and all they had to say was, and eat your vegetables, but they didn't even say that. So anyway.
No, people sat on the couch and gained the COVID 15, 20, and 30. Now people are like, oh, now I need to go lose all that weight. Oh, well, it's going to be the Christmas in 6 months. I'm like, there is never a better time, in some cases, to do anything than now.
True,
Now
humans
being
are
any day.
humans. Yeah, humans are humans. So we have greatest technology on earth to kind of help us to be more human, but yet, some motivation, some inspiration is really needed. So that's where tech is really helping us, don't you think?
Yeah. And when you think about the human behavior, like what I work with on my team is like when change is scary, when technology, like, oh my gosh, automation replaces me. Oh my gosh, nope, don't think about it like that. Let's look at what does the advancement of all technologies allow us to do. Allows us to be smarter and better and more capable and deliver better care and have greater insights into all of the things that are important to us. All of us went into the practitionership of healthcare typically for a reason. There's a small subset who like, oh, I needed a job and I got it. But once you get there, if you stay, it's because you care about the outcomes on humans. Technology is such a opportunity to accelerate all of the things that allow us to live longer, healthier, happier lives. So it's the embracing of like these technologies, wherever they are headed. I always want to know what's coming. So I have a choice of what I need to use in my environment at any given time. Some organizations are hugely well-funded and capable of trying all the new and latest technologies. What happens if you run a 200 bed or even 50 bed critical access hospital out in the middle of Missouri or Kansas, where Brian and I first knew each other from our days in Kansas City? Brian's still there.
Yeah.
What do you do if someone's out in a rural area? How do you bring technology to them in a way that allows them to live a longer, healthier life? My goodness, let's just hope the infrastructure gets there, because I have people on my team whose parents live where there's no broadband yet. So
right.
Meeting people where they are is huge. You have patients that don't have broadband. You have patients who show up wanting their information on their phone. How do you create all the right constructs to meet people where they are and to bring the right technologies at the right time into your organizations? And when you don't have it, that's where that co-opetition of saying, I can send you over here instead, because they can take care of you, knowing that day to day you will come back to me.
Beautiful. Irene?
Inspiring talk. Thank you, Sarah. This is so much fun. We've learned a lot, and it made me think actually in few different dimensions. From being a patient to being a technologist to really doing something good for this world. Meaning, like yes, healthcare companies helping to reach the audiences that are patients that are not readily reachable. Because we still have digital divide even, right? Some more digitally savvy, some less. So these are excellent point. Sarah, anything in like takeaways for the audiences in closing this talk? Because this is wonderful.
Yes. Number one, we are all patients, by the way. And so when we talk about the patient in the abstract, I am a patient in my own company. And so what do those experiences mean to me? As a technologist, how do you deliver the right technology at the right time? And more importantly, how do you bring everybody together that's using those solutions in a way that allows them to feel like they're a part of it versus having it happen to them?
I love it.
Loving
Sarah.
it. Thank you, Sarah, so very much. Thank you. Have a wonderful Friday. Fantastic weekend ahead. Same to you, Brian. Thank you.
Thank you. You as well. Take care.
All right.